Hey. Stand by. What are we going to do? Three, two.
Hello, I'm Don Walker, and I'm Communications Director for Brevard County Government. We're here today to provide an update on the COVID-19 pandemic, hurricane season, and other issues that affect our county. And I have some guests with me here today on the panel. I have, to my right, Maria Stahl, who is the Administrator of Florida Department of Health. I have John Scott, who is the Interim Emergency Management Director, and also Matt Wallace, our Public Safety Director. Also with us today is Jessie Ray, the county social media specialist, and we have Tara Roth doing sign language interpretation. She's with the American Sign Language Services based in Kissimmee. The county has invited Tara to be with us today because we're trying to do our due diligence in making sure that we reach as many of the members of our public as possible. Also, for your benefit, once these Facebook Live events are completed, they are reposted later on Facebook, on the Brevard County Government Facebook page, and they are closed captioned. And we are also working to include closed captioned videos of these events on YouTube. And one way to get those closed captioned is if we can get up to 1,000 subscribers. And if you would like to subscribe, all you have to do is go to YouTube, look for SCG TV 499, SCG TV as in Space Coast Government Television. But it's SCG TV 499, and then when you call that up on YouTube, there will be a red bar there that says subscribe, and we would encourage you to subscribe. So with that said, we'll start off with the pandemic update from Maria. Maria, the table's yours.
Okay. Good morning, everyone. As Don said, I'm Maria Stahl, the Health Officer and Administrator at the Florida Department of Health in Brevard County. As of this morning, we had 7,092 cases of COVID-19, or have had cases. That's an increase of 50 for today. The age range of our cases have ranged from age 0, or less than 1, to age 104. Labs that reported out today were 1,104 at a 4.33% positivity rate. To give a perspective, since we've started testing in March, we've done 91,611 cases, an overall positivity rate of 8%. Our county has done a total of 15% of our citizens that have had COVID-19 labs done. Our deaths, unfortunately, we did add 5 more deaths today for a total of 205 deaths. To give everyone a little perspective on the age range of our deaths, we've had 74 of those deaths over the age of 85. 67 were between 75 and 84. 32 were between ages 65 and 74, 21 between 55 and 64, and 6 of those deaths were under the age of 55. The lowest age for any death in our county was age 40. As we talk about our hospitals have been doing tremendously well. They've been very stable. Their capacity has ranged anywhere from 25 to 30% for both beds and ICU capacity. So doing very well there. The trending overall in our county when looking at the month of August compared to July has done tremendously better. We've definitely flattened our curve and actually a little bit on the downward trend. Over the last 2 weeks, we've added 790 cases, and to give a perspective, in July, we had more than that in 1 week. Over the last 14 days, we haven't had any days where we reported more than 100 cases. We had 8 days that we were actually under 5% positivity rate, and the range is 2.87 to 9.43%. As we're saying, we are flattening the curve and getting better. That does not mean that we need to lower our vigilance. I think everyone in Brevard County has done a tremendous job with the face masks, the social distancing, the avoiding crowds, which is attributed to this stabilization and downward trend. And we do need to continue these mitigation efforts. Most importantly, as I've been saying all along, please stay home if you're sick. Don't go to work, don't go to the stores, don't send your children to school sick. Stay home if you're sick. Wear face coverings in public places, maintain social distancing, hand hygiene. And also, I did want to mention, we are moving into the fall, which is our flu season. So flu vaccines are abundant out there at pharmacies. Please, 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 anyone over 6 months is encouraged to get the flu vaccine. So please get that flu vaccine. That's very important. The emphasis overall continues to be monitoring our long-term care facilities who are continue to receive infection control visits. We are watching our schools. We are looking at all of our healthcare facilities, and priority testing continues to be for healthcare workers, first responders, those over the age of 65 who are vulnerable, and students and teachers who are symptomatic. Thank you, Don.
All right, thank you, Maria. I also should mention that because this is a Facebook Live event, we will be entertaining questions once we've finished our presentations. So if you have questions for any of our panelists here today, please submit those via Facebook. And we also have a couple members of the media here with us today, and we'll be taking questions from them if they have any. With that, I'm going to turn it over to John Scott for an update from Emergency Management.
Thank you, Don. Good morning. My name is John Scott. I am the Interim Emergency Management Director for Brevard County. I want to touch on a couple of quick things this morning. One, to follow up on what Maria said regarding testing. One of the things we work very hard through partnerships is to make sure we've got testing as available as we can get it throughout the county. So I want to highlight some of those partnerships. First is our state-run site in Palm Bay. It's at the Eastern Florida State College campus there. That is a 7-day-a-week, 9 to 5, no appointment necessary site. In addition to running the COVID tests, they also are running the antibody test there. If you're not familiar with the antibody test, that is a blood draw. They will take your blood while you're there. They will process it. They'll ask you to park and wait for the results. And right now, in about 30 to 45 minutes, you're getting results whether or not you have the antibodies or not. So that's a nice thing. It's fairly new. We've only had it there for about a couple weeks, so we're glad to see we're getting that. Additionally, our friends at the health department, Maria's folks, are testing at their Vieira clinic by appointment. That telephone number is 321-454-7141. That is Monday through Friday, 8:15 to noon. We also have a partnership with Health First to help us reach those on the barrier islands, and specifically Merritt Island. That is by appointment only. That is 321-434-3131. And then we have a partnership with Parrish in the north end of the county at several mobile sites by appointment only. Again, that's 321-268-6139. Addition to those partnerships we have at the county and with the Department of Health, we know that numerous urgent care centers are testing. Regular primary care physicians are also providing testing, so I think we are getting a good job making sure we have tests available for folks. You heard Maria highlight the number and the percentage of our population who've been able to be tested for this event. We will continue to make sure that is as available as we can. One of the other things that Don asked me to talk about today is hurricane season. Obviously, everyone knows we are in the teeth of hurricane season, and Laura going into Texas and Louisiana last night is a very stark reminder of what this time of year can be, and certainly our thoughts are with those in Louisiana and Texas and sort of as we move up through the Ohio River Valley area. Seeing what what happens there is a very good reminder of why it's so important that we are prepared this time of year. Again, August is almost over, but we still have September and October, which actually for Brevard are our 2 biggest months. So we certainly don't want to let our guard down just as we move forward. As a reminder, Matthew was an October storm. Both Irma and Dorian were essentially Labor Day storms, or right around Labor Day. So we have a lot to do there. One of the things we're doing on social media right now is a preparedness campaign. So if you see messages coming out about tips to what to do if you lose power, what to do if we have water issues, a reminder of having a plan, making sure you have a disaster supply kit, knowing where you can get good information. And we're going to continue to put that information out through as many avenues as we can so that we're all staying as vigilant as we can. This is a weird year for everybody. Maria talked about vigilance for the pandemic, which we absolutely all need to do. But we also need to make sure we're doing the same for hurricane season. If you've listened to these a couple times before, you've heard me say, pandemics are a problem, but hurricanes don't care about pandemics. They're still going to do their normal things, and we've still got to prepare and make sure we're keeping people as safe as possible. If you have any questions, you can always go to our website, which is www.embrevard.com. You can sign up for text alerts by texting Brevard EOC to 888-777. That way you make sure you're staying informed. And of course, we're on both Facebook and Twitter. John?
Thank you, John. So shortly after the COVID-19 pandemic began, Brevard County received $105 million from the U.S. Treasury Department that we've been working diligently to assist the public and small businesses and other elements of our community to work through this pandemic. So I'm going to let Matt talk a little bit about that. Matt, please.
Yeah, absolutely. Good afternoon, Brevard County. I'm Matthew Wallace, your Director of Public Safety for the county. As John and we've talked about before too, the whole reason that we do these information sharings is so we can be prepared, we can be informed, and we can be safe. So thank you for joining us today. Thank you for listening in. And again, as the end of this Facebook session, if you have any questions, it is our job as county servants to make sure that we give you all the information that you can to make informed and prepared decisions for you, your family, and your loved ones. I would like to give a quick update. As Don had talked about, Brevard County was very fortunate to receive CARES funding from the federal government. We continue to work with all our county agencies, our municipalities throughout the county, our county charter offices, and our school board partners to review and refine their requirements that we can support in their battle against COVID. A quick update from the Small Business Nonprofit Economic Relief Grant Program. We are sneaking up on almost $5 million that we've reinfused back into the community through that program. I would like to say that that application period does not have a closure period anymore, so we will continue to take applications until the funds are exhausted or we get more funds. So if you are a small business and you meet the requirements, please continue to submit your applications. You can see those requirements on brevardfl.gov, and there is a hot button link to Brevard Cares resources on that main page, or you can do brevardfl.gov/Brevard Cares. So either one of those two websites will get you to the site that has the resources and information that we can help you support your businesses and your families. Quick update also from our individual assistance program. We have over 900 applications received, and we've infused over $2.2 million back into the community through that program. From our food stability program, we have provided over 30,000 meals back to Brevard County, which touched a little over 2,000 households. So those two programs continue to be active, and we again continue to encourage you, if you need that help, to go to brevardfl.gov and click on the Brevard Cares Resources link to apply for those programs. Changing gears just a little bit from my perspective as the Public Safety Director, we do have Labor Day coming up here shortly. And I would just like to plug that to please be safe over the long weekend. We will have lifeguards out on the beaches if you determine to have a family activity and go to the beach. We will overstaff to make sure that we're there for you. But please be safe and be informed and be prepared if you do enter the water. Rip currents are always a problem and an issue, as well as the heat. One of the things that we have been talking about from a heat perspective is we have had some very, very hot days here in Brevard County. So watch the hot weather, watch for heat exhaustion, have work rest cycles, and please hydrate as often as you can. It's not getting any cooler anytime soon, so please watch your heat output as you're outside working. Again, one of the biggest things that we do as your county servants is to give you information so you can be prepared and you can be safe. So please interact with us as often as you can, ask us questions, and again, thank you for your time and attention, and please be safe, Brevard County. Duncan, back to you.
Thanks, Matt. I should also mention that as part of the CARES Act money, we've been distributing, the county has been distributing personal protection equipment to small businesses, and we actually have an event today where we're distributing 200 kits to businesses. You don't have to apply. You can just show up. It's from 11. It started at 11 o'clock today, and it goes until 3 p.m., and it's at the Catherine Schweinsberg Rood Central Library, which is at 308 Forest Avenue in Cocoa. But we initially started off with 2,000 kits that included 200 procedure masks, 25 reusable cloth masks, 2 boxes of gloves, and 2 bottles of hand sanitizer. And of those 2,000 kits, 1,800 of those kits are now out in the community and making a difference for those small businesses. And we're working to get more of those resources that we can distribute also at dates to be announced later on to our small businesses. I wanted to mention, if you have any needs of assistance or you have questions about COVID-19, you can always call 211 Brevard. It's just simply dialing 211 on your phone. They're a great resource to get you to the services that you need. And as far as regular updates from the county, when we're not doing these Facebook Live events, which we've been doing every other Thursday at 11:30, you can find us on Facebook at Brevard County Government and at Brevard EOC, or on Twitter at Brevard CO_FL and at Brevard EOC. Also on YouTube that I mentioned earlier at SCGTV 499, and on our website at www.embrevard.com. So with that, I'll open the floor for questions. Jesse, if you've got any to give us.
Yeah, we've got a couple that are coming in on Facebook. So Maria, there's a couple of them for you. I know we've touched on this one a little bit, but if one person tests positive more than once, does that count as one case or does that count as multiple cases?
That only counts as one case. What happens is it's the first time they report positive that is reported as a positive. Any subsequent positive case is not reported as another positive.
Okay. And do you happen to know, maybe off the top of your head, what the false positive rate is?
I do not.
Okay.
I do not. What I can say is the rapid tests, the rapid antigen tests that are done is fairly accurate for a positive test if it's done the first 5 days of symptoms showing. If it's not done within the first 5 days of symptoms showing, it's not real accurate. And the negative test through a rapid is only 50% accurate. So if you have symptoms and you go get a rapid test and it's negative, really, really encouraged to follow up with the regular viral standard test, which is the gold standard.
Okay, thank you. Couple more for you. Is it possible for people to see the numbers of COVID cases per city and not just per county?
Yes, that breakdown is on the state dashboard by city and by zip code.
Okay. And you had mentioned mitigation earlier. Do you know how long that will continue, or an estimate?
My estimate would be at least until we get a vaccine out there and we start seeing some herd immunity happening. Okay. So I think a lot of that really is dependent on cases and vaccine development.
Awesome, thank you. Dawn, so the small businesses that have been approved funds through our Brevard Cares, Can you talk about how and when those funds are being dispersed?
Yeah, so it's a 4 to 6 week process. Once you put in your application, I can tell you the turnaround has been much quicker than what we're projecting with the 4 to 6 weeks. It's more like a 2 to 4 week. Once you've been approved and received recognition that your grant was accepted or is being distributed, it's about a 2 week turnaround before you get the check in the mail. And the check comes to whatever the address is on the W-9 form that you submit as part of your application process.
Thank you. And we have gotten a couple of questions regarding schools being open and COVID. Can you discuss that just a little bit?
Yeah, so a lot of people think that Brevard County government's also over the school system, which we are not. So I can't really speak for the school system. I do know schools have reopened, and I know they've got measures in place. But beyond that, I really cannot comment about what the school system's doing.
Okay. We did have one person ask, and I know that we've done it recently, is there still the $50 CARES money available at the farmers markets that we're still doing?
Matt, are you aware?
I'm not aware.
I got it.
Okay, John.
So Jesse, I'll take that.
Thanks, John.
Yeah, so the Farmers Market Program, it's through our CARES Food Stability Program. That is available. You go on site, you sign up, and you get some, basically what amounts to tokens. And then we continue to do that. And if I remember correctly, it is Thursday and Friday. One is in, I think we're Melbourne on Thursday, and Friday we're in Titusville, or that might be reversed.
Wickham Park on Thursdays from 3 to 6, and Titusville Welcome Center on Fridays from 3 to 6.
Look at me nailing it.
Look at you. You're awesome.
Maria, we're going to go back to you really quick. Somebody asked, how will we know when herd immunity has been established? Is there any kind of...
Ideal is 80%. We're not expecting ever to reach 80%. Once we reach the 50, 60% immunity, then we'll be doing really good. And I've seen actually some reports that said we're even going to be happy with 40%.
Okay. I think that's really all the questions that I have time for today.
Do we have any? Okay, go ahead.
Regarding COVID-19 testing, are you guys looking at, or are you guys doing right now, any of the saliva testing that's starting to gain momentum across the country? Are we still doing nasal swab testing, or are we?
Primarily, we are still doing the nasal swab testing. I do know the saliva testing is becoming popular. The long-term care facilities, their staff, they're getting the curative kits, and they are the saliva test, or the oral swabs. The actual saliva, we've not seen here yet, but I can almost guarantee that it will be. And things are changing day to day when it comes to testing. But primarily, we're still doing the viral nasopharyngeal, which is still considered to be the gold standard right now.
Okay. For hurricane season, as people start getting ready, hopefully we don't have a case like that. What can people do right now, maybe to get ahead of maybe a potential circumstance where, we have a threat? Is there anything that people can do right now to get out ahead of things?
Always, absolutely. We talk about getting ready for hurricane season, we preach preparedness. I mean, our goal is to build a culture of preparedness in Brevard County, and it starts by following our 5 steps to preparedness, which is, know your risk, which obviously right now is hurricane season, plus the pandemic. Second is to make sure you have a disaster supply kit. And in your disaster supply kit, in addition to your food, water, hygiene items, you want to do things like add face coverings, additional hand sanitizer or soap, alcohol wipes or anything like that. Anything you can do to help increase your hygiene is a good idea. Then having a plan. Where are you going to go? Are you going to evacuate? What are you going to do? We talk a lot about in these sessions, should you evacuate, should you not? If you live on a barrier island, if you live in a mobile home or a flood-prone zone, if you're someone who lives in a mobile or manufactured home, or you're someone who requires power or water for your health, you really need to think long and hard about evacuating, especially when you see something like a Laura. If you're someone who maybe lives in a newer structure and you've got, you've taken steps to mitigate your windows and your doors, If you live on sort of the west side of the county out of a flood-prone zone, then you probably don't need to evacuate. You're in a good, strong structure, so stay there, reduce your risks, those kinds of things. And then always know where you go to get good information. You know, Don's outlined it a couple times, where to go to stay informed. And then we always encourage people, get involved. Like once you're ready, make sure your neighbors are ready. Make sure your family's ready. Make sure your friends are ready. Like this is a communal effort. It's the only way we'll be successsul.
How would COVID-19 affect, like, if we had to open up shelters? I think we had one of those cases come up with,
Sure.
what was the one? I can't remember the name of the last one that went by, Tropical Storm Isaias.
Yeah, so
how would that work?
So we're obviously taking measures and spend a lot of time to make sure that we're doing all we can to reduce the risk of spread of COVID-19 in shelters. So we're doing things like, you know, we'll have face coverings available for people, and you know, staff will wear them, and we're strongly encouraging everyone else to wear them. We'll have additional hand sanitizer, soap, alcohol wipes. We're increasing our cleaning. But the biggest thing we're doing in shelters is the biggest thing that we've been preaching here, which is, you know, let's use what works. Let's use face coverings. Let's make sure we're socially distancing. Let's be respectful of each other's spaces, and let's work together. What that also probably means for us operationally is we'll open more shelters than we usually do so that we can achieve that social distance that we're talking about. We're taking it very serious, and we're doing everything we can to make sure we really reduce the risk.
Sid, did you have a question?
Yeah, I was asked to ask, I know you said you couldn't talk about the schools, but Maria, do you know of any reported cases since school started with the school system?
That's really a question that would have to be asked to the school district.
Okay. And then one more question, with the upcoming holiday, I guess some concern that people should, on the beach, social distance, on the islands and boats, that kind of thing. We got a holiday coming up, it's like it is Memorial Day, and you know what people are.
Just as John said with shelters, and the same goes anywhere. We need to be following all the mitigation methods, messages we've been talking about. So if you're at the beach, there's no problem being at a beach, but don't be there in a crowd of 50 people. Social distance. I don't think you need to wear a mask at the beach because you're not indoors, but definitely social distance, but there's no problem being at the beach, but avoid the large crowds.
Dave, you have
Yeah, I have some questions for Maria. Could you talk a little bit about assisted living and nursing homes? The death rates seem to be higher in Brevard County than other counties compared to the 12 deaths. What lessons have you learned from that trend?
Yeah, what I can say, Dave, as I mentioned actually 2 weeks ago, Brevard County, 25% of our population is over the age of 65. We have 168 long-term care facilities amongst assisted living and long-term care. The state has taken a very proactive approach with long-term care facilities. We have regional teams that go out to do infection control visits. We have our EPI team that goes out to do infection control visits. The Agency for Healthcare Administration for several months now has been mandating all of their staff or vendors that go to long-term care facilities get tested every 2 weeks. Many of the long-term care facilities are also requesting their residents being tested, and we have the regional teams that go out to do that. As we talk about the deaths, and I'm not just going to say long-term care facilities, it's definitely in those over the age of 65 in our county, and that is just reflective of the size of our county, as well as the amount of people we have over the age of 65. We know that is the most vulnerable population, those that have the comorbidities.
Is there anything that you've changed in your procedures or the long-term care facilities procedures since this has started that you learned going on to?
Well, there's been changes throughout from the very beginning. I mean, in the very beginning in March, we didn't have regional infection control teams like we do now. So the state has definitely reacted with different measures. I mean, in the very beginning, we weren't doing staff testing. So a lot of that has evolved as time went on. Any individual facility that we go into or the state team goes into to find anything that needs to be corrected, then we talk to them about it. Our epidemiologist has also been starting to go into long-term care facilities and do an education to the staff. So it's evolving. It's evolving, and depending on what we see, we do the education and talk to them.
And
All right.
also,
Go ahead, Dave.
one more thing.
Last question.
About the county jail.
Mm-hmm.
Do you think there should be more testing of inmates in the jail? There's been,
I think Sheriff Ivey has done a very good job. When there's symptomatic individuals in the jail, he has tested. When we identified positive, then the same regional team that I was talking about with long-term care facilities has gone into the jail. They've gone in 2 separate occasions now. And they've done testing in all the areas that the positive cases were. And I can actually tell you the majority of the cases coming out of the jail are asymptomatic cases. So it's not anything that anyone felt would be, would be or should be proactive. So I think the jail is doing exactly what they need to be doing at this point, and they're following our recommendations.
All right, Maria, thank you. All right, so with that, we're going to wrap it up, and we will be back in 2 weeks from today with another update on where we're at countywide on the pandemic and CARES Act money and hurricane season. Thank you for joining us.